Welcome back to Quick Hits, the podcast where we explore the latest trends and innovations in healthcare technology. I'm your host, Tyler Smith, joined by Ken Booth. On this episode of Quick Hits, we're joined by Dr. Anita Harris-Brown, Vice President, CNIO, and Clinical Applications Leader at Cincinnati Children's Hospital. Dr. Harris-Brown shares her journey from bedside nursing to healthcare IT leadership. This path began with skepticism about electronic health records and led to shaping one of the nation's top children's hospitals through technology and innovation. We sit down with Anita to talk about the pivotal moments that led her into clinical informatics, how she balances the clinical voice with technology roadmap, and why servant leadership is at the heart of her approach to change management and adoption. From gamification in pediatric care to the role of AI in avatars and engaging both patients and clinicians, this conversation demonstrates how technology can truly transform the healthcare experience. And for those looking to grow into leadership roles, Dr. Harris-Brown also shares her perspective on mentorship, finding your why, and staying curious in a fast-moving healthcare environment. Let's get into it.
And welcome to another episode of Quick Hits. I'm your host, Ken Booth, joined as always by my co-host, Tyler Smith. Tyler, how are you?
Great, Ken. Good to be here today.
Yeah, I'm glad to have you and certainly glad to have our guest. We are joined today by Dr. Anita Harris-Brown. She is the Vice President of CNIO and Clinical Application at Cincinnati Children's Hospital Medical Center. Dr. Brown, welcome to the show.
Thank you. It's a pleasure to be here.
Yeah, really happy to get a chance to talk to someone with your background, knowing that you kind of started off in clinical and then where you ended up. So we're kind of hoping to open up with that and just kind of start with a discussion about your journey to where you are now. So we know you started in nursing. So how did you take the leap into leading clinical applications at really what is one of the top children's hospitals in the country?
Yeah, what a great question. And definitely reflection in terms of my journey, but it's been quite a ride. I can say that. So I actually began my career in Philadelphia
Mhm.
as when I began my career, we had to do some med surge, and then I went into pediatric critical care. The one pivotal moment for me is when I was invited to join a design session as our hospital was transitioning from paper records to computers. I was actually one of those naysayers. I said, this is not going to work, because I actually loved my trifold nursing papers. And so that experience just opened the door for me. So after that project, I actually went into nursing quality. And this was even before informatics was really recognized in the field. I then transitioned to Houston, Texas. And during my transition in Houston, Texas, I was at a large pediatric organization there as well. And they were also on the journey from paper to computer. And during this time, I was what we call it voluntold to help lead this effort. But I was told from a quality perspective because I came in with the lenses from a nursing quality perspective. And so during that journey, this is when informatics became, new and just the effort was being pioneered. So I actually received my title. That was the first time I received that title as a nursing informaticist. My initial passion was always around clinical operations. So I was fortunate enough with, when I was at um, in Texas to get those experience in the clinical operations perspective. But over time, I realized that my true calling was at the intersection of healthcare operations, clinical care, and technology as well as leadership. So, my experiences really help me understand how we can use technology to support safe patient practices as well as user adoption, which I think was so critical in today's healthcare, as well as giving me the opportunity to lead here at Cincinnati Children's.
Wow, what a background! And it's awesome to hear someone that started off with there's no way we need, this will never work, we don't need EHRs, because you were so comfortable in your
Yeah.
paper, but for you to eventually see the need. So I guess that kind of leads us to our next question. How do you balance the clinical voice with that technology roadmap, because we keep pushing boundaries, and certainly as the CNIO at Cincinnati Children's, you've got like these two sides that you're trying to balance. How do
Yeah,
you do that?
yeah. So, of course, that's a great question, because it gives me the opportunity to really speak to the underpinning of clinical informatics. And so, one thing that I truly believe is balancing that clinical voice with the technology roadmap is always important as we prioritize the people who deliver as well as the people who receive the care. And so for me, it is devoting my time listening to our clinicians, our patients, and our families, and
Mhm.
understanding their needs and pain points. So I'm always asking, what is that sand in your shoe? What are those rocks? What are those pebbles? Right.
Mm.
Um, and that approach to understand that clinical insight directly informs those technology decisions. So, whatever we implement, truly the benefit that has to benefit our patients and our clinicians rather than just adding complexity. So, I'm consistently asking myself, and so does my teams, what kind of experience do we want to create? And what problem are we aiming to solve? From there, we work backwards to identify the technology that will get us there the most logically way.
Mhm.
So one thing that I also keep in mind that technology is truly supported when we take in mind the patient journey, right? So that's when we know we got it
Mhm.
right. um, just taking in mind that the patient goes through all points within our system, and so does our clinicians. And so, how are we leading from a different direction?
Excellent. Well, yeah, certainly we can understand that you have to come up with a good outcome, and you want to have a good outcome, especially when pediatrics are concerned.
Right,
And that really brings with it a unique challenge, right? And so, I mean, we probably get a little into what those challenges are, but more importantly, I think for our discussion is how exactly are you adjusting technology or tailoring technology to really meet the needs of this younger generation of patients along with their families.
right. This is so pivotal when it comes to pediatric care. Prioritizing children and their families isn't just a philosophy, it's truly the core of every decision we make. So before introducing new technology, just like I said before, we truly try to understand the needs of our patients. And so it's not that we're just adding complexity or this is the shiny object of the month, right? But truly talking with our kids and parents and clinicians to discover what will help bring that joy. So, in terms of the pediatric perspective, that magic happens when technology isn't just functional, but is also fun, transforming hospital visits into adventures and making daily care engaging. So, if you can put your eyes in the perspective of a kid, it can feel scary, right? And so, always keeping that in mind, whether we gamify health tracking using interactive apps or using colorful, friendly interfaces. We really try to ensure every tool integrates that seamless approach into our kids' lives. And it's key to make sure we have that clinical insight as well,
Mhm.
right? To always guide us to create and flourish. We want to make sure that innovation in pediatric results in happier, healthier kids. and that technology works for our kids, right? And our families.
Yeah, it's so funny you said gamify. I mean, that's
Yeah.
I have a young nie I think she's Gen Alpha. I think that's is that the current new
Yes,
generation? I don't know if we're in the
that's
Gen
it.
Beta yet, but
Yeah.
uh, everything they do is with a screen, and so
Yeah.
I imagine that that creates probably unique opportunities, like with gamification, but
Yeah.
then also unique challenges in terms of communication with them. Are some of the changes you make in terms really just about engagement, really, or is it? I mean, in terms of the gamification, or what else in that respect?
Yeah, it is. So I can give you a very tangible example. And so, um, in our cardiac patient population, in terms of their cardiac rehab, gamification became like, how do we get these kids engaged into physical therapy, right? And
Hmm.
so we use the technology associated with gamification to so the kids can feel like they're batting with our local Reds uh, baseball,
Oh,
Oh,
nice.
cool.
baseball
Very
folks. And
cool.
so, yeah, so we really try to use like the avatars behind the scene with gamification just to make it more tangible for children so it's not scary, right?
Hmm.
But yet also meeting their, healthcare outcomes as well.
It's funny because I'm like trying to remember. I remember
Hmm.
my pediatrician, Dr. Farber,
Hmm.
and now I'm remember. I mean, and I was a child of the '90s, so none of these devices existed. Ken's
Yeah.
obviously got much more context,
Hmm.
um, but yeah, it's interesting. I guess one of the things that comes up, I hear a lot about is like screen time.
Hmm.
Parents really, it seems to be it's somewhat divisive. It's maybe like the
Yeah.
way like television when we were growing up was like some parents let their kids watch TV all day, some didn't let them watch at all, and some
Right.
were regimented. But what you're talking about is like sometimes these tools are interwoven into the technology. So I'm wondering like some initiatives that you're proud of, that have improved clinical efficiency or care delivery, and then how they also meet or don't meet kind of the requirements that parents have around their children's usage of technology.
Right. And so I think, I'm a mother as well, right? And so I'm one of those mothers that's always thinking about, are you spending too much time? And I think about when I was younger, how we would just be outside, right?
Right.
And I think one of the things that when you're looking at technology and from a clinical informatics perspective, we have a model, people, process, and technology. We know that technology is, I'm going to be honest with you guys, is about 20% of the solution, but we have to
Mhm.
engage with people in a different way. And so I must say, and I'm very proud that we have a comprehensive child life program here where they get an opportunity to kind of take a step back to the non-technology items like we have pets that we can
Mm,
have them engage in and different different things that is not technology focused. But I
right.
think in a pediatric environment, and this is very common, that we have that comprehensive focus so it's not so driven to your point, the TV or the iPad or the phone, right? And what are
Hmm.
some of the other things? But I do appreciate that we use technology to engage in just some of those activities that don't feel fun, like physical therapy sometimes,
Right.
right? Or when kids are getting MRIs and we're using different technology, far as avatar, when they're in the radiology department and they see all the different screens and all the fun usage of technology. And so I think it's a mix again of when is the when is the best time to use that technology and truly understanding the need of the kids as well as our parents. So one of the things that I'm super proud of as well is our family advisory group. We actually have children and parents on that group, and we can ask those simple questions. to
Excellent.
how do you want to be recognized? What are some of the things the technology can help you with? And so, again, I think always understanding the need and asking the questions about what do you want your experience to look like and what problem are we trying to solve? We can kind of work backwards to say, does technology fix that problem? Or is it just the engagement with other people, our connection,
Hmm.
as well as, what are our processes? And so, I think, in terms of having that mixed modality and understanding, it's just a village. It's a village
Sure.
to make those decisions. Yeah.
It's super cool to hear about the Cincinnati Reds
Yeah.
initiative. I mean, I think when I was a child, I was much more into football. So if Chad Ochocinco had told me to do my physical therapy, I would definitely have done it. The avatar or not. So yeah, really really cool to hear how you can leverage sports.
And I must say, for me, I just said baseball team, so I truly apologize.
Yeah.
It is the Cincinnati Reds.
Yeah.
So the patient engagement, then I can totally tell how technology can be very beneficial. But going back to what you said about trifold and the early days when and Ken and I remember those days well.
100%.
We remember the folks that did not want to see us walking down the hall when we were there to implement whatever IT system, whether Ken was doing Otter, I was doing Epic.
Yep.
And so it is really cool, Dr. Harris Brown, how you went from being a detractor to being
Yeah.
a fan. But yeah, wondering now when you roll out new applications or workflows, I mean, obviously we're in a much more digitally native world, but how
Mhm.
do you really approach partnering with the frontline nurses and physicians?
Yeah, yeah. That's a great question. And, I just want to say you are so absolutely right. It's a battle once you implement something, right? It truly could be a battle in terms of adoption. And so I think the key, and I may be kind of jumping over, but I just want to say some of the keys is adoption and change management, right? So when you think about how things are fast paced and moving very, very fast. And
Sure.
here I go. I'm going to give myself a kudo out to leveraging clinical informatics. I think is absolutely essential. So if you even take a step back to say, and we talked about this early, just that intersection of that clinical informaticist, provider, nursing, allied health clinical informaticist is truly that bridge. They bridge that gap between clinicians as well as IT. I always call ourselves the translator. And sometimes we used to say back in the day, we were like the pastor bringing the groom and the bride together for this beautiful union, right?
Yeah.
And I think it's always really taking that step back and saying, what's in it for me? Like we have to really think about when I was at the bedside, I always wanted to know what's in it for me if I use this. So go back to my example from the beginning when I was such a resistor. I said, oh, this isn't going to work. But then I had to sit back and say, what's in it for me? So having that core underpinning, so I can understand the direct value and relevance to work, right? Another big part I do want to say that we executed here is just our strategy with super users. So they act as our champions throughout those processes. And so we live in a technology driven world today, commercially, within our work environment.
Mhm.
It's all around us, right? And we do have those champions, those innate champions, and we use them to help ensure that our changes are sustainable. And we also use them as that initial frontline focus to say, hey, does this make sense to you, right? That voice is very important. And making it a priority to understand the impact of every change and balancing that to push forward while maintaining that focus on safe staff well-being is very important, and that's what our champions do in terms of you know that balance between implementation, or the balance between should we do this, what problem are we trying to solve, implementation to sustainability.
Let's take a quick break. At Health Data Movers, we know that data migration isn't just about moving information from point A to point B. It's about making sure your clinical and operational data is accurate, accessible, and secure, so your teams can focus on delivering care, not chasing records. Whether you're consolidating systems, switching EHRs, or sunsetting legacy data platforms, our data migration experts help you move confidently through complex transitions. We bring proven tools, repeatable processes, and deep healthcare experience to make your migration seamless. If you're planning a system change or even thinking about one, let's talk. You can learn more at healthdatamovers.com. Now, back to the show.
So you talk about problem solving. And first of all, if we could just go back and if I could say as a grown man, if I had the ability to
I'm looking
engage
forward to
with
wait, sorry, what are you about to say? Ben, that's all I think of you as.
I love it.
I've been spending a lot of time with my mother, so it changes your perspective a
Yeah,
little bit. But
yeah.
as an adult who's had an MRI in the last year, I would love to have engaged with an avatar or something to make it fun.
Yes.
But just saying, no,
Yeah.
I think that's a great thing that you guys did for those kids. Um,
Yeah.
you talk about just some of the other challenges, you mentioned, just staff availability
Mhm.
and staff kind of being overworked. So we think about the rise of AI. We think about ambient
Mhm.
technology,
Mhm.
listening technology, even
Yeah.
virtual nursing visits. But
Mhm.
with pediatrics, is your approach the same, or do you have to do things a little bit different?
I believe it's the same.
Okay.
Um, I think when it comes to just that pediatric healthcare, I feel we're leading the way. So we already adopted a lot of these tools. So we have AI ambient technology.
Okay.
We have virtual nursing. So we're at a point we're not just testing it. These innovations, they're essential to our daily practice. So we're expanding ambient voices, not just to our providers, but to our nurses as well as to other services,
Hmm.
but really identifying a use case, and then having that balance to understand AI in itself, right?
Hmm.
We have a whole organizational strategy in terms of AI uses, because now we're so heavily inundated
Hmm.
as a healthcare environment. AI is everywhere. It's like Oprah. You get an AI, you get an AI, you get AI. But from an organizational perspective, we really have to put guardrails around safe AI practices,
Sure.
as well as clinical judgment in AIs. And so not only are we using it, we also have guardrails in terms of how we use it and what the expectations is. Because again, our goal is not to make technology complex, or put technology in clinical environments where it becomes unsafe practice, but really drive intentional use cases to say, is this the right use case? Are we, what experience do we want? I'm going to always go back to those 2 points, because they're basically the underpinning of the first two questions that we ask. What
Mhm.
experience do we want, and what problem are we trying to solve? So, in terms of virtual nursing, we have expanded that. It's expanded that through our organization. It is our care delivery model because we found a lot of opportunities for efficiency. Our nurses love it, absolutely love it. Um, and we are using, avatars is the thing. So, we're trying to even figure out from a training perspective and adoption of new clinical practices, how do we use avatars?
Hmm.
We want to also make education fun for our clinicians. And so we are doing a lot of work around that in that area as well. But at the core, innovation and the strategic use of technology, that is just that's our focus on how we're going to shape moving forward.
Gotcha. And you'd used an acronym before, or at least you said people, process, and
And technology.
technology, right?
Yeah,
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 that's great.
yeah.
So when it comes to implementation, we can talk about that all day, but that's kind of only half of the battle. So once you've adopted, how do you approach change management, especially in
Yeah.
a really dynamic clinical environment? What's your approach there?
Yeah, so I kind of touched on this a little bit, but it's so funny because I right before I meeting with you all, I had a conversation with my team because we just implemented a huge project um, on July 8th. And when we start our projects, we always start with the end in mind. So the end in mind is how do we measure success? What does sustainability look like? And what does scalability look like? And so just because we flip the light on doesn't mean that we're done. And then when do we say operationally you own the day-to-day practice? And so we kind of start those conversations and those operational plans in the beginning.
Mhm.
So everyone knows exactly what they're doing. When our KPIs tell us to move different levers, um, how are we speaking to, yep, we're successful. Go live is not an indicator of success, but what is the impact and outcomes of what we did? And so I think it's all about changing that trajectory that, technology by itself is not the solution. Um, just that core domain of people, process, and technology with the ability to digitally enable operations, the people part, to sustain the technology.
Yeah, so Dr. Harris Brown, Cincinnati Children's is known for academic rigor and clinical excellence. So, how do you ensure your technology strategy supports that mission without overwhelming the clinical staff?
Oh, wow. So at Cincinnati Children's, our approach is always about making sure technology truly supports our mission and our academic rigor, especially when it comes to clinical excellence. So, our goal is always to make sure we are not putting extra burden on our clinical staff. I'm not saying we get it 100% right all the time, but that is always our goal. So, we truly treat technology to be a vital part of our healthcare infrastructure, right? And we really build these strong partnerships between operational and clinical teams. And so making sure our ER practices are set up to enhance that clinical excellence and support robust data reporting that highlights our outcome. So, one key alignment in terms of our technology and our clinical teams is we really believe that we have to be um, cohesive partners. And so through that, just like a lot of other organizations, we have very structural governance. So that's key, right? However, we want to make sure our governance does not create bureaucracy. What we want to make sure our red tape, what we want to make sure that we just don't roll out new tools and we focus on strategic execution with
Mhm.
always keeping clinical excellence at the forefront. And again, our governance, I'm just so super proud of our governance because it is multidisciplinary, right? And so understanding like what our true north is in terms of, uh, our strategic imperatives. So when we have new programs, we make sure that the chief nurse informaticist officer, myself, my CMIO, one of our clinical informaticist folks is at the table during the decision processes. And so I think that's key, making sure we are at the table, um, and, making sure we balance things in terms of change management as well as just the overhaul of multiple initiatives coming at clinicians, and then sequencing all of these initiatives to say when do we pull different levers to say stop, go, start, or maybe not at this time.
Sure. And it seems like analogous to your trifold, like ambient is probably the next like paradigm, or not, sorry, not ambient, I'm AI, although ambient seems to be the main application of AI that everyone buzzes about. So I guess Freudian slip, but yeah, the AI and governance is so key to
Yeah.
AI.
Yep.
Um, and yeah, would love to hear maybe a little bit more about your kind of outlook on where we'll see that, evolve given not just what the technology is, but also what will be accepted by governance groups and end users.
Yeah. And so in terms of AI, we we just had our uh, kickoff of today of an AI clinical informatics work group. And so we have a data governance, we have an AI governance. And so in those groups, we talk about policies, procedures, we talk about more so of that strategic vision, prioritizing. But this particular group, we had to put together, and it's multidisciplinary. So you have informaticists, you have IT folks on it, as well as clinicians and operations. And we made this group very small because we wanted to give them the room so they could get the work done, right? So we started with a teams of teams approach in terms of building trust and then giving them the opportunity to make those decisions really quickly. So this group is the actual group that will test that is testing the AI. They're driving the use cases and they're also helping to balance, you know, when should this piece of AI get put into production? So it's not just about, hey, we got this new cool AI tool. Let me give you a demo and show it and show you how it works. But
Right.
it's truly how do we operationalize AI so we don't see our clinicians spending so much time trying to fix the errors that we see. So it is a error factor or reliability factor in terms of trying to understand those pieces as well. And so that's where our AI governance comes in terms of putting those guardrails around the usage of AI to give it thumbs up or thumbs down. And then we turn it over to that work group to start, testing, execution, operationalizing, and really understanding. Those measures to success in terms of KPIs.
Sure. No, super insightful. It's a question that I definitely am curious to hear answers across different organizations. So thank you for providing
Yeah. Yeah.
Yeah,
some
for sure.
insight there.
Yeah, and the one thing I do want to call out, because we just had this conversation internally, it is truly, like I said earlier, we have AI just inundated. It's in everything. It's multiple vendors. Is even with our preferred vendors, is AI for all, right? It's in our everyday life, and really trying to understand. It's just what is that inventory, and what is good and what's not good. And so I think just like most organizations, we're still trying to understand all of these different models and really try to be more strategic on how do we pull those different levers.
Well, we know Ken's a grown man, an adult,
Yeah, he's an adult.
Most
and but
days.
and I'm guessing we don't have any of your patients listening. If you are a pediatric patient listening to our podcast, wow, you are bound for great things. But so somewhere in between these two, there's upcoming nurse informaticists and clinicians who want to make the leap into healthcare IT leadership like you did. And so would love to hear your advice for those folks.
Yeah, I actually love this. I love mentoring and coaching others. And so this is probably one of my favorite questions that you asked me today. And the first thing I start off by asking folks, what is your why? Right? First, take some time to really understand your reason of wanting to move into technology, knowing your why. That is so important because what that does, it gives you that drive and resilience you'll need to build strong relationships and navigate those challenges along the way, right? So my next uh,
And I love that, by the way. It's Abby who just started with us, our SVP of Client Services. As she was ramping up, that was a question that she told me she wanted to ask all the new team members that she'd be managing. So,
yeah.
seems great minds think alike.
Yeah, yeah. What's your why? The next thing I ask folks, and the advice that I give them is once you identify, yeah, this is what I want to do. Immerse yourself in the various roles within clinical informatics. So you may want to be an analyst, you may want to be an informaticist, you may want to be a trainer. And I also recommend people shadow some folks,
Mm.
right? Conduct your own research, spend that time. Also try to get a mentor. That's very, very important. And one other key factor is join some of those professional organizations because that's also a way to expand your network. And if your organization has a technology or clinical informatics super user program, get engaged. Get engaged with that. Get engaged with your committees. Become that champion in your current environment. And so the last piece that I say, if this is truly what you want to do, um, and this is what you love, and you want to deepen your expertise, then I tell people consider further education. Get your certifications or master's degree, because each step will bring you closer to a leadership role in healthcare IT. And I tell people, most important, stay curious, stay involved, and never stop learning. And I also, and my spare time, not that I have a lot, I'm an adjunct faculty for a organization where I teach clinical nurse informaticists. So I get so much uh, insight from and it's so funny because I'm giving folks advice, but then when I hear from others about their why, it just inspires me more in terms of a clinical healthcare IT leader. So, and that brings me back to my why as well.
Oh, that's great.
Love it.
So our final question, we just want to throw in a little something fun. Just what's one thing that people might not know about you that has shaped your approach to leadership?
Oh my goodness. So this is actually funny, and most people ask me, "Why do you do that?" So honestly, the one thing a lot of people might not know about me is how much I prioritize staying connected with everyone on my team.
Hmm.
So I've been at Cincinnati Children's a little over 2 years. I have a portfolio of over 200 plus employees. And so within the last 18 months, I made a point to meet with every person, every single person on my team for 30 minutes, just just to connect.
Wow.
I call these step level meetings, and it's interesting how these meetings get put on their calendars, and sometimes they feel a little anxious, and they get, we start to meet, and they settle down, and it just taps into my why as well.
Mm.
And I let them know that these meetings are important more and probably more important to me as they are to you because I am a servant leader. And if I can't connect to the people that I'm serving, then I always have to ask myself, what am I doing? Because I'm an advocate for them, right? I'm here for them. I'm a servant leader. But it's very informal. It creates those personal connections, and that shapes my approach to leadership. And it also keeps me in touch with the heart of my team. They always thank me, and they also share that leaders at the vice president level never really just took that time to spend with every single person individually.
Mm-hmm.
So I will complete my last group of folks in October.
Okay.
But,
Wow. So it takes the whole year.
yeah, well, a little bit over a year, because my schedule was busy, their
Yeah.
schedule was busy, but I wanted to make sure that, you know, I had that connection with people that I serve. That's important. And that's what shapes my leadership.
I love that.
That's great.
Yeah.
Thank you so much for the time that you've taken out of your clearly busy schedule,
Yeah.
Dr. Brown. So we really appreciate you coming on the show and hope to have you on again.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.